Hi, I'm Jim Berklan, editor of McKnight's Long-Term Care News, and I'm here with noted economist and author Ben Stein at the NIC Annual Conference, and he's just given a keynote address. And Mr. Stein, you have some interesting observations or thoughts on what might be going forward with regard to reimbursements for the operators.
Well, I think that if the Obama healthcare plan goes forward, and the plan really is to cut $500 billion out of Medicare, first of all, it can't be done. Second, even in trying to do it, they're going to have to cut reimbursements at every level of senior care of every kind, and they cannot do that without cutting quality. It's not talking about cutting a few cents. There just isn't enough fraud, waste, and abuse for him to cut that out without care being affected. It's like saying, a person has a tumor on right in the middle of his cerebral cortex. We'll just cut that out, and he doesn't even need anesthesia. It's a giant, enormous project, and basically simply can't be done. Serious political leaders do not ever make these claims about being able to save so much from fraud, waste, and abuse. There just isn't enough fraud, waste, and abuse. And if there is that much fraud, waste, and abuse, it's just probably become part of the system and just can't be cut out. So the only way they could go after this would be not with a scalpel, but with a meat cleaver to just say, well, we can't find the fraud, waste, and abuse, so we'll just say every reimbursement is being cut by 18%. And that seems to be the only way they could possibly go about it. And when that happens, the political outcry will be just stupendous as people lose their benefits, and that will be the end of that program.
Now, do you think handicapping, or is this a real likelihood in your view, or just a partial? Are we going to get halfway there?
Well, the incompetence of the Congress and I think Mr. Obama is an intelligent man, but I think he is just too new to the national scene and to national governance to be trying to get through a program this complicated this quickly. So, but his juice with the Congress is such that he may be able to get it through. So I think he'll get something through. Anything will be a problem, because anything that seriously tries to take a lot of money out of senior care is going to be a real problem. I mean, you can't do it by electronically reorienting patient records. I mean, that saves a tenth of a cent out of a dollar, a hundredth of a cent out of a dollar. You can't do it by capping malpractice awards. That saves a few pennies at most out of a dollar, at most out of a dollar. You have to do it by just really hacking into reimbursements, and that's going to be a real problem if he gets it passed. Your question is, will he get it passed? So far, if he really puts all his prestige on the line, he'll get something passed, I suspect.
Okay, serious times, and maybe something will happen, maybe it won't. What do we tell our providers out there? How can they move forward from this? Because a lot of big things are happening above them. What advice might you have for them?
Oh, I have several pieces of advice. One is, you must mobilize all of your resources in Washington to try to either stop this bill or get it sensibly financed, so it's not financed by taking the money. This healthcare bill is not financed by taking money out of senior care. I mean, if it's going to be financed, it should be financed in a straightforward way, either by adding to the deficit or by tax increases. You cannot do it from cutting existing programs. It simply can't be done. Once whatever passes is passed, work very, very hard with your representatives in Washington to make sure that the Code of Federal Regulations implementing this is such as to give you the right to appeal, the right to document your real costs. Don't just let them take a meat cleaver to your costs and your reimbursements, but insist that as this bill is codified in the Code of Federal Regulations, you have a process by which you can prove that such and such an amount of money is spent, and that therefore you must be repaid for it.
Well, thank you very much. Very insightful comments.
Thank you. You're very kind. Thank you very much.